Well, Morten, welcome to this discussion about how to improve the radiation experience for patients and families. I'm so excited to be speaking to you in Denmark, but your coffee cup, can you just show it to us?
Yeah, right. This is the one.
And so where did you get that coffee cup?
I got it from a conference at the Wollongong University in Australia. It's my favorite cup.
Well, we're thrilled that you're using an Australian cup. Look, just before we hear about your centre, the Danish Centre for Particle Therapy at Aarhus University Hospital, in a nutshell, what is proton therapy?
Proton therapy is a highly specialized radiation therapy. It's radiation with small particles, the smallest that we have, protons. And where we actually accelerate protons up to a very high energy level, and then we can actually use it for radiation therapy. What is so good about the particles or the protons is that we can irradiate a tumor to a high dose without spreading out dose to the surrounding normal tissues, which means that we can have a high cure rate and the lowest possible risk of side effects.
And what sort of patients, what groups of patients do you mostly see where you're working in Denmark?
We treat children with cancer. And the reason why we treat the children is that they have a very high risk of very severe side effects. And also they have a risk of having a secondary cancer due to the radiation exposure. Therefore, we have to limit this radiation exposure to the body of the child, and this we can actually do with protons. Then we treat adult patients with brain tumors, some patients with breast cancer, some patients with esophageal cancer, head and neck cancer, and also other types of cancer.
Okay, well look, let's turn now to our primary focus, which is how do we improve the experience of radiation for patients and families. And I want to focus particularly on how you've designed the Danish Centre for Particle Therapy. So as I walk in, what am I seeing? Describe what I'm seeing and why you've designed it like that.
First of all, I mean, that was very important for us to design it in a way that it should be for the patient and not for the personnel there. So, first of all, we wanted it to be we wanted light to come into the building. And for that, we have a very big atrium. Actually, you enter the building into this big atrium where there's a waiting area. We also found that it should be very important that we should have an easy wayfinding, so you can find your way directly from this waiting area into the treatment room. Also, we had a very creative architect to do the design of the building, and for that reason, I mean, we have a very nice building with I mean, we have wooden coverage of the walls, and we have a very large garden. Actually, it's a jungle. We don't have jungles here in Denmark, so we need to actually make them artificially. And it's a beautiful room, and it's a very nice room to work in. It's also very nice for the patients to stay there.
And what was the thinking behind having a lot of light and wood and a jungle? What were you hoping to achieve in terms of the patient and family experience?
First of all, I think it's extremely important that we appear professional. It should be quality. It should actually give you an impression of quality. Secondly, it should actually be a peaceful atmosphere. We know that a lot of our patients, they are scared of what it's going to do, what we are going to do with them. I mean, what kind of experience will they have? And for that we have to make a very nice and quiet and atmosphere, and I think we got it.
In the waiting area, it's a very special part of your centre, isn't it? And it allows both mingling and seclusion. Could you explain that?
I mean, we know that patients often want to sit and talk because they can tell about their experience, that they have had, earlier during the course of the disease and during the diagnosis and so on. So they need to have someone to talk to, and very often they can find this by chatting with other patients. So we try to kind of make small groups where they can sit and talk together. Right now, during the corona, we have to separate, and we do that, and the patients, they do it as well. But in the normal days, they can really have a good talk to some of the patients, and also to the person. And we have these very nice small groups where they can do that. We have very modern Scandinavian design of the furniture. Actually, I was very skeptical when I saw it for the first time, but now I can see it works.
Why were you skeptical, and what do you mean it works?
Because I thought that the patient would prefer to have something which was very comfortable to sit in, a comfortable chair. But actually, most of them, they actually want to sit in a niche instead of, because that's what they want to do, sit there and enjoy themselves with their cell phone or maybe a book or something to read in. It actually works.
And is part of the idea that it doesn't look like a hospital?
That was part of the idea, yes. We didn't want to look kind of a clinical place. I'm in a hospital. So it's actually a very nice, it looks more like a town hall or something.
And you mentioned earlier that you went for easy wayfinder. Can you explain what that means and then how you've achieved it? Give us a visual image of how you make it easy to find things at your cancer centre.
There should be straight lines between the entrance, the waiting area, and straight lines again between the waiting area and the treatment room. And you should be easy to find. We have 3 different treatment rooms. You should be easy to find room number 1, 2, and 3. And this is actually the way it works.
And the bunkers, what have you done? Have you done something inside the bunkers? Bunkers, of course, is where you get your radiation therapy, your proton therapy.
Because it's actually a very heavy construction. There's a lot of concrete, and it's very difficult to make anything, nice there. But we tried to do it with colors, to have a lot of kind of bright colors. And we had an artist to do it for us, and I think we succeeded as well.
Because you deal a lot with children, I think you have a school. Why is it important to have educational connection within a place like the Danish Centre for Particle Therapy?
2/3 of our patients have to stay here in Aarhus because of the geography. We are a small country, but even here in Denmark, travel can be too long for commuting from and back for your daily treatment. And usually you should have treatment over something like 30 treatments over 6 weeks. So we need for the children to have a school, a teacher, and we have that as well here.
And you provide accommodation, and I think you've got choices, haven't you? You've got accommodation at the hospital and in the town. Why that choice? Why was that important?
Most of our patients, they want to stay here close to the hospital, where they can kind of feel safe, and they can have easy access to if they need help. So we have a kind of apartment hotel where they can have a small apartment where they can stay. They can do their own cooking, and they can do shopping in a close by supermarket, and so they can live out here. There's a light train going directly into the city center. However, we also have some young patients who wants to stay in the city instead of staying out here, because this is in the outskirts of Aarhus. So we have these 2 choices for our patients. Then we have for the treatment as well a family house.
Okay, so you really got options. You're offering options. That's what I'm hearing. Let's turn to the workforce, because as I understand it, you feel strongly that the Danish Centre for Particle Therapy, we recruit the right staff. Now, one of the audiences for our conversation is the Australian Bragg Centre for Proton Therapy and Research, and they are building it literally now from the ground up. So what is your recommendation around recruitment of staff and why that's so important for the patient and family experience?
Well, the very beautiful thing by starting up a center from scratch, from the very, basic, is that you can choose your staff, you can choose everything from the very beginning. So we are so fortunate right now to have a very young, enthusiastic staff, people with ideas, people with a lot of energy, and very good people. So I think it's very important. Of course, we need someone who is trained in radiation oncology and in proton therapy. That is very important. But it's also extremely important to have someone who can work together, work in a team. And this is what we've got.
And how do you recruit for that culture, to nurture and sustain that culture? That can't always be easy.
Yeah. One of our primary goals was to kind of recruit from all over the country, not only from the neighborhood here and from the neighbor radiation therapy department. So that was kind of to get people from all corners of the country. And then to find people with different kind of, all different qualities and also competences, and of course people who really could work together and people who could actually see the needs for the patients and can see the patient as the one who should be in the center of everything.
Because that's your philosophy, isn't it? The patient at the centre of everything. Just very quickly, I'd love to get a sense of some of your system issues. And you've developed what you call a package of care within a day. I think it's even a 4-hour day. Just in a nutshell, what is that and why is that important for your vision of giving the patient and family the best experience?
What we found was that we should really make this kind of in patient-friendly way. And patients, they don't want to come to travel from and back several times for the kind of preparation of the treatment. They want to have it in a single day. So we made a package for the patient. So this means that we will see the patient in the morning. So they have to arrive here early in the morning. And then we can actually do all the preparation. The patient will need kind of often a mask system for immobilization. And we will do that. Then after that, we can do a CT scan, an MRI scan, even a PET scan. And we can have this within most of the patients within 4 hours. So it's a full package they can have, and then they can travel back. We need something like 6 work days to prepare the treatment, to do all the quality assurance that we need so that we can start treatment on day number 6. This is the fastest possible way of doing it.
So that's a real system commitment to timeliness. And how does that make a difference for the patient and the family?
First of all, the patients wants to get started. I mean, they have been under a diagnostic kind of pathway. I mean, they have maybe waited for pathology for some time. They needed additional scans and so on. So they really want to get started. And I think that's very important. It's important for the treatment of the patients, for the cure, but it's also important for the patients kind of, they are upset, of course, by the diagnosis, and they want to get started, and they should get started as early as possible.
And when you have that 4-hour package, are there key people in the team that are going to look after them that you try to introduce them to? Is there a personal dimension as well as a speedy clinical process?
Yes, we do have a kind of a patient responsible team, as we call it. It's a physician, it's a radiation technologist, a nurse, and even a radiographer who can actually be specific for the patient. So we all know that we are responsible for the planning of this patient, and we also see the patient on the ways during the course of the treatment. Maybe for some of them it's once a week, for some of them it's once every 14 days. So the patient will see the same team from day to day under the treatment and also during the consultations.
You mentioned the mask, the immobilization mask. I like to call it a safety mask. And as you know, a proportion of patients find that a challenging experience, whether it's radiation therapy or proton therapy. Do you have systems for identifying patients who may be struggling and offering them assistance either in advance or during treatment? How are you managing the so-called mask anxiety?
Yes, it's an important issue, and we try to talk to the patient, and we try to get the right impression of the patients to see if the patients need any medication to kind of feel more safe, and for some patients will need it, other patients they don't need it. Maybe some patients need it for the first treatment, the first 2 treatments, and then they can actually stay without. So it's important to find the patients that actually need some sedation, and we can do that.
And whose job is it to make that assessment?
It's important. It's the whole team. It's often it's the physician when we have the first consultation that we can actually identify a patient who will need some tranquilizer. Maybe it's the nurse who talks to the patient afterwards. Maybe it's the radiographer who will make the CT scan. So they can come to me and say, well, the patient you just talked to, he will need something to calm him down. And so we will do it.
Just before I turn finally to the Danish system, because I think you've created a model that you're very proud of, and I'd love to conclude with that. But, you know, we began our conversation with the discussion of entering a wood-panelled, light-filled jungle and how important that was. And then we've gone on to these human issues of staff recruitment and systems. In your mind, what is most important in terms of improving the patient and family experience? Is it the designs of the building and the layout and the colour and the furniture, or is it the human factors and the clinical systems?
My own impression is that it's a human factor that counts over everything else. But you should never, neglect that there's also a factor of the building and all the equipment that should be as friendly as possible. But it's very important to play on all these horses when we're building up a center.
I understand that at the heart of the Danish model is this sense that the whole system distributes ownership across your referring centres and to you, the proton therapy centre or particle therapy centre. How do you gain that group ownership?
Well, we decided early on that we should actually distribute the competences and the ownership of this center and the responsibility of the center to our colleagues in the radiation oncology centers in the country. There's 7 of them, because these are actually the ones that refer patients to us. We did it in the way that we asked them to define which patients should be referred to our centers for this very highly specialized treatment, and which patient could actually be treated in their own departments or centers with the conventional radiation therapy, which is also a very modern and a very good treatment. So we had this kind of discussion going on, and some of the patients that we actually had to test by simulating the conventional radiation therapy and the highly specialized treatment that we can give here, and see which is the best. And they can actually do it. And most of our patients treated here in Aarhus, they have their treatment as part of what we call a clinical trial. And the owners of their clinical trials are actually the clinicians in the referring radiation therapy centers in the country. And we find this is extremely important for the sustainability of referral of patients to our center. And I think it's important that we are not just the ones owning this place and patient can be referred to us, then we will treat them. It should be done in the close collaboration with our colleagues.
And part of your commitment too is to have multidisciplinary team assessment for all or most tumour types?
Yeah, we do. We have more than 20 different multidisciplinary kind of organizations. There's one for each of the large tumor sites, such as head and neck cancer, brain tumor, children, etc., etc. And they were the ones that actually defined the patients that should be referred to us, patients that should have what we call the comparative treatment plan for selection to this place. And they're also the one kind of looking over us and overseeing what we are doing.
Has there been a patient or family involvement in any of the things you've described in developing these systems or giving you feedback on how it's going? Any sort of, interaction with the patients and families?
Yes, and we want to do it even more than we do it, but we have done it so far. But we had patients during the design of this building to kind of tell us what is important for them, what was important for them, and what kind of priorities should we make in the design of the building, and also in the way that we set up our workflow with in the preparation of the treatment and also in the daily treatments.
I'm a head and neck cancer patient survivor 7 years ago with 30 sessions of radiation and weekly chemo. You mentioned you do see head and neck cancer patients. In what circumstances is it useful for head and neck cancer patients to get proton therapy?
It's actually very useful, at least, but this is what we believe right now, for something between 1/3 and half of the patients, and we actually have to test the patients and see which treatment is the best for the individual patient. And for some patients, we can actually spare a lot of the neck, of the swathering structures, so that there will be less side effects, less effects during the course of the treatment, and also long-term effects. Some patients actually suffer from very severe side effects like xerostomia and swallowing problems.
Dry mouth and swallowing, yes.
Exactly, yes.
Well, look, just finally, Morten, there are people watching this conversation who are, even as we speak, making decisions about the new Australian Bragg Centre for Proton Therapy and Research, including the internal design and the human systems. One bit of advice based on your experience in Denmark, what would it be to those teams working it all out?
Spend a lot of time in preparing this. I mean, it's relatively easy to build a proton center, but the organization that should be there and the system in referring of patients, the education of your colleagues in the clinics outside, the ones that should refer patients to you, and also take care of your patients after the treatment. It should all be organized. And that should be done ahead of time, before the Proton Center is completed and can start operation.
Well, Dr. Morten Høyer, thank you so much for your time and for joining us through cyberspace from Denmark. It's been an absolute delight to speak to you, sir.
Thank you very much.